Good morning, everyone, and I hope you had a good weekend. And it's a beautiful morning, idyllic morning here in Springfield. I want to thank our sign language individuals who are here. Young ladies, thank you so much. We appreciate that. I'd also like to again thank Dr. Kerouac, the President and CEO of Bay State Health Systems, and Dr. Robert Roos, the Chief Medical Officer of Mercy Hospital and Trinity Healthcare, for always being here every Monday. People look forward to all the great work that Bay State and Mercy are doing, and the partnership that we have to defeat this COVID-19. So thank you. As with those two gentlemen, we will do accordingly. After I give my brief update, they will come up to give the updates pertaining to Bay State and Mercy, and then subsequently, right after their updates, the media will be able to ask them any questions or comments so they can get back to their important duties at their respected medical institutions. I also want to thank Patrick Leonardo from AMR for your continued efforts. You've been a very good partner on whether testing or the homelessness, and we appreciate that. Let me just give you a quick update. Confirmed new cases, and a good trend continues. The weekend we saw 4 new confirmed cases on Friday, 6 on Saturday, only 1 yesterday on Sunday. Total confirmed cases, that's what Commissioner Helen Carlton Harris and I go by, are 3,072 since this COVID-19 coronavirus pandemic started back in mid-March. Deaths, and another good trend, again, to those who have lost loved ones, our thoughts and prayers and encouragement and sympathy go out to you and your families. This is the 3rd week in a row there are no deaths that have occurred. And let me give you the breakdown on that, just for the record, on our daily updates. So 57 white at 43.5%, 31 black African American at 23.7%, 41 Hispanic at 31.3%, 2 Asian at 1.5%. On the where these deaths have occurred, long-term care facilities 57, residential 74, again for a total of 131. But we have not had a COVID related death for the past 3 weeks. Knock on wood on that. We also, we continue to be in the green zone, which is quite an accomplishment, as the Governor Baker had indicated a few weeks ago, for a mid-sized urban center in America. And we are going to continue to do our due diligence and be vigilant on that. Senior meals continue to be delivered. Testing continues, stop the spread. Besides with Bay State and Mercy and Tapestry, AMR, and Commissioner Helen Carlton Harris will give you more of an update on that, the Stop the Spread initiative of Governor Baker. Commissioner Carlton Harris also continues to monitor colleges. We have seen in other states and other cities that are housing colleges and universities, their numbers have gone up. Knock on wood, ours seem to be holding steady, but she continues to work hand in hand with our colleges and universities in the Springfield area. Halloween, in consultation with Commissioner Helen Carlton Harris, we have given guidance to what will or will not be allowed for Halloween. People have to remember, we're still dealing and defeating a pandemic right now. So there'll be no door-to-door trick-or-treating allowed. And there's a various amount of reasonings why that is not going to occur. But in turn, we wanted to make sure families and young people in structured ways, guidances that, if done properly, events can be done following the guidance that we gave. But no door-to-door trick-or-treating will be allowed here in the city of Springfield. And that's pretty self-explanatory on that. Also with Commissioner Helen Carlton Harris, the governor has extended, we have spoken to some restaurants already and met with them, a 60-day extension from November 1st to January. If the weather holds, we will continue to work with our restaurants on outside dining. It's been quite successful, and we want to make sure that they stay afloat and continue not only to stabilize but move forward until restrictions are relaxed. Overall, we held a beautiful and heartfelt 9/11 event. It was held on the riverfront Friday. Many of these things had to be adjusted because of the COVID-19 coronavirus, and but we held that, and it went very, very well. Phase 2, I issued late Thursday afternoon, early evening. Phase 2 of the recreational marijuana and cultivation RFPs will be going out sometime in early October. We had a very harmonious and heartwarming event Saturday morning with the BLM, the mural painting, and I want to commend Councilor Tracy Whitfield on that. That went very, very well. The Ride to Remember was also Saturday. That was very scaled down and virtual, and a minor remembrance at Mary Lynch at the Scavina Beauregard Park and Memorial. That was held Saturday. Went very, very well. We continue over the weekend discussions with Judge Ireland as we continue with at Pacula, Commissioner Clapperud and myself on addressing and moving forward on the DOJ. Many things that we have done. We'll be issuing an update on that, on Commissioner Clapperud's continued efforts. And I did notice that the Boston City Council, or recommendations coming from Mayor Washer to Boston, many of those things Springfield has already done, some a few years ago. And then one interesting thing was on the Civilian Community Police Hearing Board, which we've had for a number of years, how the City Council in Boston is requesting subpoena power. Myself and my administration have been requesting that for the past 3 years, so I'm hopeful that our Springfield City Council will look to move to that for the residents and the police department. Speaking of police, Commissioner Clapperud indicates to me nobody out on COVID. That's fantastic. There is a warrant out for an arrest. We had a busy weekend. Again, overall crime on my weekly stats, even with everything going on, is down 5%. But we still have these areas where negative activities will occur. Warrant out for arrest of the murder on Spring Street. So that individual is being hunted down right now. We had a tragic accidental death that occurred on Chapin Terrace. Accidental and tragic. 2 individuals there. Busy activities, the narcotics unit under the command of Captain Brian Keenan. They've been very active and doing great work. But once again, they arrest individuals who have current charges, not only past charges, gun, narcotic violations, Newland Street house party, and hundreds of bags of heroin, money. Also, individuals pulling guns, weapons at police officers, body cam picked up to make arrests on that. And also the Aquarius Club or Aquarius Lounge, there was a shooting that occurred outside. We understand there was some type of event going on there, but we understand that the management is trying to cooperate with the police department. So we'll see what happened there. Fire, Commissioner Calvi indicates to me there's nobody down on COVID. It's fantastic. 63 Mulberry Street, Dr. Seuss. That house has been such a detriment and headache to the neighborhood. We have boarded and secured it, and yet you still have vandals and individual squatters and drug-type individuals getting in there. There was a fire. Our firefighters had to put that down. We will now pursue, and I think the neighborhood will like that. The house is in tough shape. So the house needs to come down. Public safety and in accordance with trying to, the beautiful homes and families and individuals that live on Mulberry Street. Fire also did respond to that tragedy and accidental deaths that occurred on Chapin Terrace. Chris Signoli, DPW, nobody down in COVID. Fantastic. They're all up to speed. Bulk is back on track. Again, the vendor that took it had some issues there. That has been straightened out. School Superintendent Warwick and his team, over 2.8 million meals have been served. Just over the weekend, there was over 103,000 meals served. The Superintendent Warwick will go into it. There was a new adjustment. I appreciate the superintendent. We went after the waiver from USDA. They gave us the waiver. So now meals are 17 sites, Monday, Wednesday, Friday. Times have been adjusted to 2 to 6 p.m. to accommodate working parents. Central High School will stay Fridays at 9 to 3. Meals will be packaged to be served for every day, including weekends. Superintendent Warwick, along with Pat Sullivan and Director Pat Sullivan, Facilities and Parks, and Commissioner Helen Colton Harris, update they continue to work with Bob Kirshner, our industrial hygienist, on the continued reviews of all our school buildings. And again, there's not a question of air quality under the new COVID-19 rules and regulations on ventilation of the air. We want to make sure it's safe and sound for our students, teachers, administration, and staff. Schools reopen tomorrow remotely, Tuesday, September 15th. Laptop supplies, I was out in Six Corners Saturday morning, and Brookings School. Families were lined up out there getting any of the laptops and supplies that were needed. And they are going to continue attendance. This is very structured now, not unlike when we had to shut down when COVID started. The superintendent will get into that. Attendance will be taken, and grading will be done for our students. Facilities and Parks, Pat Sullivan indicates to me, we kept the splash pads opened. They are now officially closed. We kept them open longer than expected because of the hot weather we were having. The Sea Arena is now open, ice skating arena, the hockey arena in Forest Park. And again, Pat Sullivan continues to work with Bob Kirshner on all our buildings. Golf courses are in great shape. I'm not a golfer, but I've heard from family and friends, and they're in great shape. Franconia and Veterans Director Sullivan indicate that we were number 2 ranked stay vacations from the Mass Golf Association. So that's pretty good for public golf courses here in the city of Springfield. So to Pat, to you, and Ryan Hall, our golf professional and staff, congratulations on that. Echo Dev Chief Development Officer Tim Sheen will give an update. The homeless RFPs have gone out, and again, we are concentrating on these, whatever entity gets it, to concentrate and work with Commissioner Claproot and Commissioner Helen Colton Harris to help our police and health department deal with the addiction end and try to get these people off the streets. And we met with South End residents too on continued issues that are arising with the methadone clinic, and get them the help that they need and take it out of the police realm as we diversify, unless it's a criminal type activity. Director Sheen indicates to me that we have given out over $7 million in HUD CDBG monies to help out our restaurants, businesses, residents with mortgages, utilities, rents. $7 million Springfield on its own has given out, besides any type of federal or state support, and we're going to continue to do that to the best of abilities. Segueing into our finances, Chief Administration Financial Officer TJ Plant indicates to me we've started, as we've done with other natural man-made disasters. Josh Norman, who is now with GP Strategies, used to be a Rensselaer. We brought him in as we recruit every dime we can get our hands on for the past natural man-made disasters. Same thing here. We put in nearly $1 million submitted for reimbursements from FEMA. This is our first phase we're putting in. FEMA usually accommodates us with 75% reimbursement, so we're probably going to have to come up south of $250,000, but we're going to continue to pursue that for the taxpayers, residents, and businesses of the city of Springfield. We're down about $1 million for FY21 budget, and overall, since this COVID-19 coronavirus pandemic started, we're down just about $5 million in deficit spending to be able to provide for our residents and our business community. Law, HR, and Labor, Solicitor Pakula and Attorney Bill Mahoney, the standard updates that were given to me at that point in time. So with that, let me turn it over to Dr. Mark Kerouac, again, the President and CEO of Bay State Health Systems. Thank you.
Well, good morning, everybody, and thank you again, Mr. Mayor, for hosting these events. I'm thrilled, delighted to hear that Springfield's in the green and that there's no one from police, fire, or other public service workers who are affected by the virus. That's really great news. You know, it's 6 months ago and a day since Dr. Andy Artenstein, our chief physician, and I met with the media. I remember it was a Friday the 13th. Maybe there was a message there, too. To ring the alarm bell and to warn people about the imminent threat of COVID-19. I appreciate the steady coverage that the media has given to this serious threat since then. Bay State had yet to see their first case. The first case came 2 days after that, but enough was going on in the rest of the state that we thought it was important to alert people. While the calendar says it's been 6 months, it's felt a bit more like 6 years to me and to many of the others who've been involved with this. Within 3 weeks of that warning, Bay State Medical Center shot up from its first case to 180 cases, with 40 of them in the intensive care unit. That's a very far cry from the 11 we have in the hospital today, with only 3 in the ICU. Within 2 days of that warning, we shut down elective surgeries and expanded the bed capacity of the hospital, looking at every nook and cranny in the place that could safely take care of a patient. We went from 720 to 850 bed capacity with nearly 200 COVID cases, but another 400 non-COVID cases. We didn't know how high the peak would go. Thank God it didn't exceed our capacity. We ramped up virtual outpatient care to the point where 60% of our outpatient encounters were done virtually at the height of the epidemic, and developed a number of safe pathways to take care of patients. Then as things settled down, we gradually opened back up, but in a very different way, limiting visitors, screening patients, having folks wait in the parking lot, called to come in, a variety of cleaning protocols, mask wearing. You all know the drill, what it looks like by now. And this included converting spaces and even constructing new spaces to safely care for patients. On the testing side, I tallied this up. We've tested 94,000 patients since the epidemic began. When we first, and over 30,000 of those tests were not for our own patients. They were to assist other caregivers, chronic care facilities, public housing, the homeless, et cetera. And that's a far cry from where we started, where we were really begging to get tests done by the Department of Public Health, which had very limited capacity. About 2,500 people have tested positive since the beginning of the pandemic, and 1,100 of them needed to come into the hospital. Nearly 250 have died, the great majority of those in the early days of the epidemic, but far fewer dying now. The percentage of people dying now is way down as we've learned how to take care of this disease, and the percentage of people testing positive has come way down as well. over the last 7 days, we've been below 0.8%, which is the statewide average. The treatments have become clearer, as have been the preventive measures. We're now able to do about 1,000 tests a day on 3 different platforms, and we're planning to expand still further as the demand increases for broad-based screening as people get back to the activities that they miss. One of the good things about this pandemic is that we have built bridges to others in this area to help coordinate the fight. This includes our fellow healthcare leaders like Dr. Roos and others in the Valley and in Western Mass, public health leaders like Commissioner Carlton Harris to help coordinate contact tracing and testing, the legislators to coordinate the legislative and regulatory response, the governor's task force, and even local manufacturers who have helped us out in manufacturing personal protective equipment. It's been sad to see that other parts of the country have been much worse, out of control. I mean, at times it seems they've lost their minds to me. Massachusetts has maintained a consistent message, and they've coordinated political leadership with scientific evidence, and that has saved lives and has kept us from having a greater catastrophe. For the people of Springfield and for Western Mass, I want to say thank you. You've sacrificed a lot, and you've maintained a shared sense of community. It's easy to say that we're all in this together, but it's a lot harder to act like you believe it, and that's exactly what you've done. Unfortunately, we need to keep this going a bit longer. In my opinion, a vaccine is 3 to 6 months away, so being vigilant and careful is still going to be necessary. We'll need to continue to be flexible as well and creative in finding solutions on how to ease back into other activities, particularly as it involves students and young children. But I believe if we hang together and rely on science, we're going to come through okay. I know that Bay State Health will be ready to see us through any surge related to greater indoor activities and the emergence of flu on top of COVID-19 this fall and winter. I hope we'll continue to be proud of how we stepped up to take on this unprecedented challenge. And thank you.
Thank you, Dr. Fairweather. We'll now bring up Dr. Robert Roos, the Chief Medical Officer of Mercy Hospital, Trinity Health. Dr. Robert Roos.
Well, good morning, and thank you, Mayor, and congratulations for continuing to stay green, as was mentioned. It's clear that we continue to do a very excellent job in mitigating the spread here locally across the state and in our region. The low test positivity rate statewide and the plateaued number of hospitalizations has been a testament, as Dr. Kerouac mentioned as well, to really a coordinated effort among so many people. The focus on health and safety first and foremost, and the entire community pulling together. So thank you as well for everyone that's been involved in this fight and for your continued vigilance. I have continued to talk about the collective journey to zero COVID because I think it's both meaningful and motivating to think about eradicating this virus. I'm pleased to report that at Mercy Medical Center we have achieved for the second time now having the milestone of 0 hospitalized patients again in our facility. This weekend we discharged our lone remaining patient with active COVID infection and have no patients that are currently admitted in the hospital, and all of our units are currently COVID-free. Of course, we know that it won't stay at 0. We've been seeing increases in infections across the country, largely spurred by interactions at colleges and universities and amongst young people. And we have seen increases in the numbers of new infections here in Massachusetts. We've had several days over the past 2 weeks where we've had more than 400 new infections, and one day where we hit 500, which is an increase from the past several weeks. But we've also had dramatic increases in the numbers of tests that have been performed statewide, where on a given day a few weeks ago, they were averaging about 25,000 or 30,000, and now we've had days testing more than 50,000 or even approaching 60,000. We know and we expect to see more infections throughout the fall and winter as well. But that being said, the efforts that have been put in thus far and the results continue to reinforce the approach that we've taken. Right here in Massachusetts, as has been talked about, we've really shown ourselves, we've also shown the rest of the country, that in large part it is completely possible to reopen and engage together as a community safely. It is possible and we can care for COVID and non-COVID patients safely and with quality in parallel. And when we do it right and follow the science, we will emerge from this pandemic stronger. That's been the focus and the mission of Mercy Medical Center all throughout, to keep safety first, to develop policies and protocols so we could care for COVID and non-COVID for the months or even the years to come, and to focus on the ways that we can transform the way that we deliver care to continue to meet the community's needs. That has also included expanding into virtual care, so we can have visits with you at your convenience from your home. It's incorporated new protocols and incorporated treatments with evidence to keep care safe, and it has meant remaining open in our emergency department, our hospitals, and surgeries and tests to make sure that you can care for all your healthcare needs, not just those related to COVID, because those conditions don't stop amidst a pandemic. The pandemic has indeed been one of the most challenging and significant public health crises in modern history, but it's also not been our only challenge, and it hasn't occurred in isolation. We've been dealing with the serious and intersecting health crises of systemic racism and unjust violence. We're also now starting to see the very real effects that the pandemic has had on mental health and addiction. And more people like myself are also growing concerned about the effects that could result from people putting off care, like other necessary vaccines or preventive tests and studies. I want to talk about the impact that this pandemic has had on addiction for a moment. As an addiction medicine physician, I've treated patients on the front lines of a different epidemic, the opioid epidemic. And I'm particularly struck by the similarities between the opiate epidemic and this COVID pandemic, but also how they're feeding off each other. And this month, September, is National Recovery Month. And it's a time to raise awareness and educate that for people with mental health and substance use disorders, if they can access treatment and beyond that process to recovery, they can live very meaningful and healthy lives. Unfortunately, the parallels are similar. Many of us, if not all of us, have been touched by mental health or addiction in one way or another, just as we all now have with COVID. Far too many people have lost their lives to addiction, despite the fact that the disease can largely be prevented by reducing exposure, by taking appropriate precautions, and by expanding evidence-based therapies, like the use of medication. And addiction, like COVID, impacts all aspects of our society, right? From health to business to law enforcement, and the negative effects also continue to impact communities of color disproportionately. More than 20 million Americans struggle from an addiction, including from alcohol, opioids, or other drugs. And before COVID, the reality was that the vast majority were not currently accessing care. This year, with COVID, we know that the challenges and stressors in all of our lives, and perhaps even more so amongst those struggling with mental health disorders and addiction, has been even greater. Addiction is a disease that often creates or thrives on isolation. Overdose rates have started to rise in areas of the country, as have suicide rates, and they're often correlated with economic downturns and family stressors. Both have been very present during this pandemic. And many 12-step groups, recovery services, or treatment programs were forced to limit their services due to risks of exposure related to COVID. So all throughout at Mercy, I want to speak about what we've done because I'm particularly proud and grateful that we've kept our treatment programs open and supported people in recovery. including our acute treatment service or detox and clinical stabilization services. Our opioid treatment program, where we treat more than 700 individuals with opiate addiction each day, and our colleagues that are providing care through Brightside for Families and Children, where we're going directly into homes before and now connecting with families via the telephone or video visits to reach into homes where children and families are in distress and need support, as well as our addiction consult service and emergency room STAR program, which stands for Starting Treatment, Assisting Recovery. We've been able to maintain these services throughout the pandemic and even expanded them in some cases because we've utilized new technology like audio and video visits. We've redesigned the workflows to allow in-person visits to occur where appropriate and alternate ways to provide group therapies. We've also revised guidelines to arrange for the safe delivery of medication for the treatment of opiate use disorder and ensured that we could still connect people to care or recovery coaching. We've also recognized the impact of the stress on our teams delivering the care and created colleague care teams to provide both resiliency, training, and workshops to support people that are working on the front lines that have been dealing with the pandemic all throughout. And so, despite COVID-19 challenging us in many, many ways, we've been able to provide services so that people have tapped into their inner strength, connected to something greater than themselves, and continued on their road to recovery. So if you are there struggling with the stress or anxiety or addiction, I encourage you to reach out. If you know somebody who may be struggling and are concerned that they may have been isolated or isolating now, please check in with them. Ask how they are. There are more than 25 million people living in recovery in this country, and not one has done it alone. The actions of each one of us, just like with COVID, matter. And the theme of National Recovery Month this year is celebrating connections, which I find so apropos. It is exactly that. And Dr. Kerouac spoke to these community connections that have been so impactful in addressing the public health crisis. It's our connectedness that will help us all emerge stronger from this pandemic and recover as a community. This is also why Mercy, with even no COVID patients in the hospital today, we will continue to reinforce the actions that have led to the progress that we've seen. We will continue to restrict visitors and screen people at our front entrances. We continue to test everyone admitted to the hospital. We have tested more than 41,000 to date, have a test positivity right at the state average of 0.8 over the past week, and we are expanding our platforms to be able to bring testing to more communities. We continue to modify our practices and our facility to meet the best practice for physical distancing, and we're also enforcing a mandatory influenza vaccine this year, and we'll be ready to deploy a coronavirus vaccine, but only when one is safe enough to do so, which I agree is not likely anytime real soon. But most importantly, we will remain focused, just as we would encourage you all to being safe during COVID and focusing on the future post-COVID. As long as we all stay vigilant, wear our masks, practice hand hygiene, stay distant, be cautious about where we go and who we interact with, and follow the science, I too am confident that we will all recover. Thanks.
Dr. Roos. We'll now have Dr. Kerouac, Dr. Roos, take any questions or comments from the media. Western Mass News is here, TV 22, Paul, Matt. Any questions or comments to Dr. Kerouac, Dr. Roos? Paul?
On the subject of possible vaccine, the CEO of Pfizer, as you said, he thought that they would know in October whether they had a safe, or they saw a safe effective vaccine. Obviously, there's a lot of unknowns about logistics and how it's distributed and that sort of thing. But just speaking in general terms, how big of a leap is it going to be to convince people to get vaccinated? It's a hard sell beyond the flu vaccine in a lot of cases. So,
Yeah, I think that the CDC has put forward a suggested distribution plan that begins with healthcare workers and those in direct contact with COVID-19 patients, followed up by people living in congregate living situations, others at high risk. So it's about a four-step process. I think at every step of the way, there are going to be people who opt out, either because of concerns about safety or because of various beliefs they have about vaccines in general. So I think it is going to be a great communications and public relations challenge to make the case that this is worth doing. I don't think that we're going to get 100% of our population accepting the vaccine or 100% immune, but really what we're trying to do is to get the great majority of people immune, 70, 80%, which should be enough to extinguish the virus.
Thank you, Dr. Carroll. Dr. Roos?
I don't have much more to add other than I think it's incredibly important that we let the scientific process regarding the phase 3 trials take their course so we can gather the data and evaluate that from a scientific perspective to understand what the true safety record is of the vaccines before bringing them to market. And I think that is ultimately how we will help be able to have anyone gain confidence in receiving a vaccine.
When you say that, do you mean like the vaccine will be approved, it will be distributed, it will be widely distributed? Just want to clarify here.
Again, this is a crystal ball exercise, so cut me a little slack on this one. But basically, I would say before a single manufacturer has a vaccine that is determined scientifically to be both safe and effective, in other words, provides sufficient protection and also can be given to large numbers of people without concern about unusual side effects. That would be my guess.
So what I see is that you're talking about the finding that it's safe, not distribution. That's a big chasm.
Yes, but remember, many of these candidate vaccines, at least 2 of them, they've already spent, millions and millions of dollars to stockpile tens, if not hundreds of millions of doses. So it's not going to be a question of developing a pipeline, but simply executing on a distribution network.
So would you say that once there is a finding that something is safe and effective, that the turnaround to distribution, because there are some media reports that are suggesting that it could be months and months and months and months before it actually starts being widely distributed. Is that kind of maybe an overstatement?
It'll be a few.
Capacity than it seems?
It'll be a few months. Just think of how we do with flu vaccine. Every year we have to make a new one. It usually doesn't come out and it's not widely available until October or so. And nearly everybody, I'd say 80% of the people who get immunized are immunized over the next 2 months through a variety of mechanisms. Some of the vaccines require unusual levels of chilling, so that creates problems with their distribution as well. But 3 or 4 months would not be an unusual expectation to sort of get it out to everybody and work your way through that 3 or 4 step process, 3 or 4 tiers.
And do you also think that, I think there's also a sense, I'm not we can't read the minds of everybody in the public, but people hear vaccine and then start being reckless. Do you think there does need to start being some type of public awareness campaign about how this, the transition rollout is going to be and how much we are going to change or not change? But, I'm just thinking like I would wait for, there to announce there be a vaccine and everybody's observing your masks on, because that's not the same thing as, actual health safety.
Yeah, but think about the vaccines we have today for, let's say, measles or mumps or rubella. These are normal childhood vaccines that have been around for years. They're generally required for school, and yet there's a small percentage of people who under no circumstances are going to accept them, even though they don't have a medical or religious reason for doing that. And generally, reason-based arguments don't hold much weight in those settings. Here in Springfield, vaccination rates among school-aged children are really quite high. They're among the highest in the state. So I'm optimistic that in Springfield, once a vaccine is out, it will be generally accepted.
Well, I'm not talking about acceptance. I'm talking about the
Yeah, I think the key to getting rid of these things is the virus goes away, right? You stop seeing new cases and your test rate goes down to 0. And then everybody breathe a sigh of relief. And then, of course, you'd have to worry about reintroducing it from other parts of the country or other parts of the world. But I think that the elimination of the protective measures will be governed more by actual case rates than by a vaccine success.
Matt, we're going to have to stay on messaging. That's the most important thing. We've been aligned, shoulder to shoulder. Helen, all of us aligned on messaging. This is what we strongly recommend. This is what we've ordered on the Board of Health, and we're going to stay consistent with that. So there is light at the end of the tunnel, but then there's going to be that transition period where we have to stay ever vigilant and cognizant that we want to get rid of this thing completely. So we've all been consistent in our message. I think that's important. Sometimes that's been lacking on the federal level. Sometimes that's been lacking on other states across the country. But I think doctors can speak to that.
Massachusetts should be proud of the consistency of message and the scientific basis of that messaging.
Dr. Roos, a question for you. You said that the Mercy had 0 cases currently hospitalized. And I posed this question to the Bay State's public relations people, so I apologize for posing directly to you. But the state is still reporting like a number of cases that are hospitalized at Mercy. Do you know if that figure includes people who might come in for like emergency room treatment, tested positive, or not sick enough to be actually admitted? So it could be 0 on your numbers, but they might have been, treated as far as the state is concerned.
So I know you've brought this up before, and I looked at the data from the daily dashboard that was released Sunday night, so last night, which has the data from the day prior. And in the case of Mercy, it seemed to match up very. It was exactly the same. There were 2 cases reported. As of Saturday, there were 2 cases at Mercy, but as of this morning, there are 0. So it may, in some cases, I think, relate to just the timing of which the information is transmitted for when it's being reported versus the time when I'm reporting to you in real time. But generally speaking, the data that Department of Public Health gets is sent directly over. It should only be for cases that are admitted into the hospital, not just for emergency department cases that are then subsequently discharged, although those positive tests are reported as well. Does that make sense?
Yes.
Okay.
Any other questions or comments from the media for Dr. Kerouac, Dr. Roos? Gentlemen, thank you so much.
Thank you.
Good health to you and your families and your staff. Thank you.
Okay.
We're now going to move to the cabinet heads and the public health aspect. And before I bring up the Commissioner of Health and Human Services, Helen Carlton-Harris, Dr. Roos touched upon our efforts to quell addiction, and I know many a times Helen and I would do events on it, but I want to commend Superintendent Dan Warwick. We have Recovery High School, and we've been doing it for a number of years, and it was controversial at the time. Nobody wanted to touch it with a 10-foot pole, but we've continued to do it, not only, and we've taken people from young students from outside areas of Western Mass, and some of those stories of their trials and tribulation, but more importantly, Dan will tell you the stories of how they've been able to move forward because of the Recovery High School and Springfield Public School System. And again, these are across the board in Western Massachusetts. I think we're the only game in town, and to give them hope and to give their families an opportunity to move forward. So, Dan, to you and your staff, I commend you on that. With that, let me bring up the Commissioner of Health and Human Services, Helen Carlton-Harris, who has done a wonderful job being our point person on this defeating COVID-19 coronavirus pandemic.
Springfield, green, very good. Mayor Sarno, again, thank you very much for your support and your constantly making sure the city stays safe. Thank you. COVID-19 update, 6.5 million cases nationally, 122,904 cases in the Commonwealth of Massachusetts. Hampden County, 7,857 cases. The city of Springfield, 3,072 cases. These are confirmed cases. In Springfield, from August 31st to September 6th, there were 29 cases for a 7-day average of 4.14. From September 7th to September 13th, there were 39 cases. That is an increase of 10 cases over this last week for an average of 5.57 cases. Again, we increased last week by 10 cases. Deaths, 194,000 individuals have died nationally. 9,001 individuals have died in the Commonwealth of Massachusetts. 9,001 in the Commonwealth of Massachusetts. Hampden County, 767 individuals have died, and in Springfield, as you've heard, the number is 131 individuals have lost their life. This COVID-19 is not a hoax. This is a real virus that is killing individuals in our country, in our county, and in our city. Let me repeat that. This is not a hoax. Testing. Thank you to Tapestry, AMR, AFC Urgent Care, and Fallon, Bay State, and Mercy. AFC Urgent Care tells me that they are testing between 100 and 150 individuals a week. AMR doing an amazing job. They are at Eastfield Mall, 1655 Boston Road, every day from 8 to 6. They have tested 5,158 individuals. 2,103 of those were Springfield residents. They are also at 595 Cottage Street from 10 to 3. Fallon is at Springfield Technical Community College, Monday through Saturday, 12 to 5, Lot 3, 460 Union Street. Although they are on the campus of STCC, as you all know, Stop the Spread, anyone can be tested, whether they are a Springfield resident or from another place. Residency is not a requirement to have a test through Stop the Spread. Contact tracing goes well. We ask that you do answer your phone calls from our contact tracing team and the Contact Tracing Collaborative. Remember, contact tracing is the process of identifying individuals who have come in contact with an infected person, collecting additional information. Community spread is still a real threat. Travel orders. Delaware, Pennsylvania, West Virginia are no longer exempt. No longer exempt. New Mexico has been added to the low-risk states, which include Colorado, Connecticut, Maine, New York, Oregon, Vermont, Washington, and Wyoming. To date, Rhode Island is still not exempt. And so it is important that we adhere to the state's guidance, which is, if you are visiting from a state that is not considered low risk by the Massachusetts guidance, then you must quarantine for 14 days or have a negative COVID test. I ask the residents of the Pioneer Valley, please, and the city of Springfield particularly, please understand when your relatives are visiting, there is the form to fill out, and I ask you to please make sure that you are adhering to this guidance so that we can keep our numbers low in the Commonwealth of Massachusetts, the Western region, and the city of Springfield. The governor has ordered that we can expand the license for outdoor dining. Our very intelligent, smart, and capable city solicitor, Ed Pakula, will take a look at that guidance, but what we see is that the outdoor guidance will remain in effect for 60 days after November 1st. Modifications can be made for snow removal and other things that must happen in order to continue to support outdoor dining. That's why our city solicitor will take a look at it just to make sure that he's advising us correctly. The mayor is anxious to continue to support our restaurants. Obviously, all of us see them as very viable and important staples in our city and in our community. The Springfield Department of Health and Human Services continues to work with Springfield Public Schools on their reopening plans. I am appreciative to their staff who are doing an amazing job in putting guidance in place as they begin the journey back to school remotely with their students. And I know that the teachers, the nurses, the paraprofessionals, the clerical staff, everyone on the team, including and particularly the superintendent, Dan Warwick, are doing an amazing job. Our institutions of higher learning, we continue to work with our colleges to make sure that we are tracking and tracing and communicating as far as COVID-19 and the safety of those students are concerned. I am very impressed by our colleges who are back. They are taking this very seriously, including suspending students who are gathering and inappropriately in terms of the numbers. So everyone is taking this seriously. No one wants to see a cluster on our college campuses, and so we will continue to work with them. We've gotten some questions about private schools and our Catholic school systems. We recognize that they are not under the DESE guidance, but all have agreed to follow, to my knowledge, the DESE guidance, and we're very appreciative of that. All are still subject to Board of Health requirements across the Commonwealth of Massachusetts. That does not change. And so we will work with private schools, public schools, Catholic systems, just to make sure we are keeping each other safe. Flu shots, please understand that we are going into flu season. We will be giving flu shots as a department, but we ask you to avail yourself of flu shots. Everyone, individuals 6 months and older, should receive a flu shot, particularly those over the age of 65 who have chronic conditions. It's important that you get your flu shot, and so we're asking that you do that. Days are getting shorter. We are all spending more time indoors. If you have individuals who are coming into your life who are not members of your family or are individuals that you do not know who are not usual parts of your household, please take precautions. That is critical to your health and to the health of those individuals who are visiting you. The days are getting shorter. We are all going inside. And also, as I said before, the emotional and mental health can really become strained when we're dealing with COVID, children at home learning remotely, and understanding that our emotional health, again, can be impacted. I want to also congratulate City Councilor Tracy Whitfield and her team. She was very clear. She could not have pulled that initiative off without them. And so I want to thank her for her leadership on the Black Lives Matter mural. I also want to thank the mayor, who was extremely supportive, and to the cabinet heads who worked on this. She definitely called out Patrick Sullivan. She called out Chris Signoli. She called out Mayor Sarno. She called out Springfield Police. She called out Springfield Fire. She was very appreciative of the team. So I just wanted to say that because I think it's important that you know that she did appreciate all of our efforts. Want to thank the Department of Elder Affairs, who continues to work very hard to reach out to our seniors. They are doing the senior meals, but they're doing a number of activities as well with our seniors, and they are considering how to do Zoom with our seniors as well, and so we're appreciative of that. The library system is still doing curbside. We are working with Patrick Sullivan, Bob Kirshner, to look at those buildings and to make sure that their air flow is sufficient when we are able to have individuals inside. We are believing very strongly that behavior is what's most important. It is really important how we behave as a region and as a city. We have the power on many levels to control this virus. So, hand hygiene was mentioned. Wash your hands 20 seconds or more if you can. Wear a face covering, and I am so proud of the residents of Springfield as I go around and people are really adhering. Businesses, continue to make sure when customers come in that you are asking them to have on a face cover. And finally, social distancing. I am a hugger. I love being around people. I enjoy just being close to individuals. We can't do that right now, so please adhere to the social distancing or physical distancing regulations. And I want to finally thank the mayor because Halloween, we want our children to have a good time. We want to celebrate Halloween. We think Halloween is very important to having our children experience joy. This year, it's not possible to do a door-to-door Halloween effort. However, we have given you some guidance and some things you can do. We can still enjoy Halloween. Your children still can enjoy Halloween. We just ask that you not do it by doing door-to-door trick-or-treating. Thank you.
Thank you, Commissioner. Thank you, Commissioner Halton-Harris. We'll now go into the public safety component report, and we will start with the Fire Commissioner of the City of Springfield, Bernard B.J. Calvi.
Good morning, everybody. Thank you, Mayor. As the Mayor stated, we have no one currently out with COVID infection in the fire department, which is a huge positive for us. We did have a busy weekend. We responded to double fatality in the North End on Saturday. And then Sunday, we had a significant structure fire on Mulberry Street, which was caused by homeless squatters breaking into a abandoned boarded-up building. I ask everybody, if you see anybody going in and out of abandoned buildings, to please call 911 and report it. This is a huge safety problem. When we arrived on scene on Mulberry Street on Sunday morning, we were met by one of the homeless people who had made it out of the house saying that her boyfriend was still inside. So that caused us to have to make an all-out search effort to try to locate this person. Fortunately, there was no one in the house, but it caused a delay, and it creates an extra hazard for us having to go in and search like that in some of these houses. Fires in vacant buildings like this are not pleasant. The people were squatting in there. There were human feces inside the building. There were heroin needles littered about the property. It's very dangerous for us to be in these places, so if you see people going in and out squatting in vacant houses, please let the authorities know so we can take the appropriate action. Thank you very much.
Thank you, Commissioner. Thank you, Commissioner Calvi. And now from the police perspective, the Police Commissioner of the City of Springfield, Cheryl Clapprood.
Thank you, Mayor.
Thank you, Commissioner.
The weekend was active for us. First of all, we have no one out with COVID either, which is very helpful too. We're at full strength. The weekend was busy. Saturday morning, there was a homicide at 135 Spring Street. A man was shot several times at that location. There is a warrant out currently for the man who did that, so we have a murder warrant in effect. They are looking for him right now. Saturday morning, we also responded at 7:50 a.m. to the Chapin Terrace, 2 unresponsive individuals, tragic accident. Nothing appears to be suspicious. Saturday night at 8 p.m., an ongoing narcotics investigation brought the narcotics detectives to Newland Street. A car was pulled over, and before the suspects could leave this vehicle and get into the party and get into area where there were a lot of people, officers tried to stop them. One took off. We knew this subject had a firearm. Officers ran behind him, telling him not to reach for the gun, to drop the gun. Unfortunately, the subject pulled the gun and pointed it at the officer. The officer did discharge 1 round, which caused that subject to drop that weapon. Arrested was Mr. Joseph Mejas Soto. He's 21 years of age. We do have pictures of the weapon involved. It's a Glock 9mm that was altered. It had the capacity to fire several rounds at one time. It was loaded with 19 rounds. Also arrested during that incident is an Edwin Rios Rivera, 20 years old. He has several open drug distribution and 5 open firearm-related cases. So again, we sound like broken records, but to me it's inevitable. I'm going to be standing in front of you and I'm going to tell you about a horror show and an officer getting hurt or individuals being hurt, and these people in our minds, and I think the average citizen, shouldn't be out on the street. They should be in jail. We also last week had a woman who was in a variety store, and she was stalked by an individual, followed home and brutally attacked in her doorway. Her injuries were severe. She came in and identified 40-year-old Titus Cruz, and it's C-R-E-W-S. Titus has a lengthy record with us. He was positively identified, and I am told he is just placed under arrest, so he is in custody.
Good.
Thank you, Mayor.
Thank you, Commissioner Clark. Thank you, Commissioner Clapprood, and to your men and women in blue, their continued brave and dedicated efforts. Again, to the court system, need your help. You could see the individuals she just spoke of. They're not choir boys. They have serious charges and arrests pertaining to guns and narcotics, and yet you continue to let them out of the courts to bring harm to my residents and to my business community. It's got to stop. It's got to stop. I'm glad that they arrested that individual, and we'll get the other individual too. With that, we'll go for an update on DPW. Our DPW director, Director Chris Signoli, is here, and I want to commend him and his rank and file too, because from day one since COVID started, they have continued their efforts, and we take for granted those efforts of trash being picked up, bulk, yard waste, other street construction, sidewalk activities. They have continued. So Chris, to you and your team, thank you. DPW Director Chris Signoli.
Mayor, thank you very much for those words. With regard to DPW, we have no employees out with COVID. Over the last week or so, we have caught up on yard waste and recycling as well as bulk. So all those services are back up to speed as far as where we need to be on a daily basis. Construction projects are moving along. At this time, a number of them in the city. We're getting very close to having a nice little ceremony with regard to the Six Corners roundabout and get some final work in there. Our other projects are moving along. And lastly, as I stated last week, our advertisement is out now for snowplow contractors. We try to hire anywhere between 150 and 170 pieces of equipment in the city. So that advertisement is out. We've increased the amount paid to the contractors as well as an incentive clause that we've had in our program for years. So we're in the process now of signing people up for snow. It doesn't look like snow, however, we need to get people signed up as quickly as possible. And that's the basic update from DPW. Thank you.
Thank you, Director Signoli. Another hot topic issue, obviously, is our children and our school system, and Superintendent Warwick and his team have done a wonderful job. He just received, I know, an early morning phone call from Commissioner Riley and commending us and actually looking for our assistance as Springfield's been highlighted how to move forward in dealing with this COVID-19 as we move forward remotely. So Superintendent Warwick has a number of updates to give you. The Superintendent of Springfield Public Schools, Dan Warwick.
Thank you, Mayor. Morning, everyone. We had some very good news from the USDA. We received yet another waiver so we can continue our meal distribution program to include weekends. Just this weekend alone, we distributed over 103,104 meals, and since school closure in March, as the mayor said earlier, we're up to 2,840,274, so approaching 3 million meals. Ecstatic, we were able to get the weekend service back up. Now we're going to switch. Same locations, same 17 locations, and including Central, like the mayor said, on Fridays. But we're going to go 2 to 6 on Monday, Wednesday, and Friday, because that was found to be more convenient for working families. So, and again, this weekend we'll be able to get that weekend service up, which has been so successful. We're concluding today our 10-day professional collaboration and planning time that we were able to put in place with the work of DESE and the Springfield School Committee so that our teachers had time to plan the remote educational process for our students, and also, and more importantly, had time to reach out to all the families and students to get that process going. When we open remotely tomorrow, we'll be ready to go with that process. Again, we're going to have full attendance, full grading, and normal school schedule. So it's going to look very much like real school, but virtually, and very much high stakes. But again, I just want to commend the staff for their great work in reaching out to all the families and really pulling all of this together in a short time frame. As the mayor said, we got a call from Jeff Riley this morning, and again, with the support of the mayor, we were able to have the laptops in place we needed for our families. We're still doing our distribution, but we have more than 17,000 laptops in the hands of families to really engage in this process, and that was a great help with the mayor. A lot of the communities across the Commonwealth are struggling by the time they were able to put in orders with some of the CARES Act funding. Their Chromebooks are all back ordered, and they're not going to have the Chromebooks to execute the plan. The mayor let us know earlier we did not have to wait for that funding. He put in emergency funding, and we have the laptops on hand to execute the plan, which is good news for our community. Also, with the support of the mayor, with our preschool, we were able to order iPads. Those are on order, and we're going to have them out for our preschool classes. As I said, that's going to be a high-stakes program when we open remotely. but the parents have all been contacted, students have all been contacted, and we're really ready to go. The schools are continuing with a supply and laptop distribution from every school, so they're working that through, getting all the materials out families need. So for someone who wasn't able to get one home last year, we're opening up that again this year. And for a family that's unable to go to the school to pick up a laptop or supplies, the mayor's been supportive with vans so we can bring them to the home. As the mayor said earlier, the support from the health department, from Helen Calton Harris and Pat Sullivan, has been great. We went to great lengths to really look at reviewing all of our schools for ventilation issues, so we make sure that our kids are safe when they come in. Again, I want to emphasize there are no air quality issues in the Springfield Public Schools, and quite honestly, over the years, with the help of Pat Sullivan and facilities, we've upgraded a lot of our systems, but we want to make sure that airflow is appropriate before we return teachers and staff into the building. So we're working now on the guidance around staff participation at the buildings, but the staff has been great, volunteering to come out and help us with the distributions at each school, which occur outside for everyone's safety. So again, we did get a call from Commissioner Riley today commending us for the plan we've put in place and being really ready to go, because that's been a struggle in the Commonwealth. And again, I want to thank the mayor for his support with that and the school committee. Thank you.
Thank you, Superintendent Warwick, and your team. I know there's been many hours put in to make sure that this temporary transition goes smoothly for our students, teachers, staff, and administration. We appreciate that. Also on the food front, we're going to continue at Central High School, as Superintendent said, with the Oasis Food Bank, John Foley, the Food Bank of Western Massachusetts, Sedesco. We have a lot of partners in it. We've had about, I think Billy Baker indicates to me, we probably had about 3,500 families who partake in that every Friday, and that is all with fresh fruits and vegetables, meat, other meals, and milk for the families who are in need. So we're going to continue to do that. I always say, before I bring up our Chief Development Officer, my Chief Development Officer, Tim Sheehan, Springfield's in the business of doing business, and you know, we've had some exciting announcements on projects coming to fruition or being completed. Others will be announcing in the very near future. But Tim and his team have really done a tremendous job. Again, $7 million of HUD and CDBG funds that we have gotten out to our business community, that we have gotten out to our residents, that we have gotten out to our non-profits to help them hang on, to help stabilize them till we defeat this COVID-19. So without further ado, the Chief Development Officer of the City of Springfield, Tim Sheehan.
Thank you, Mayor. As I indicated last week, the RFP for homeless services was out. It was due back in on Friday. There were 4 responses. Staff is intending to review those responses and have an announcement of the awards this week. In addition to what the mayor said, we also got news last week that an additional $1.7 million was awarded to Springfield in CDBG funding associated with the CARES Act. We'll be looking at programming that funding as well. And finally, I just want to indicate that so many people have gone the extra mile to support the small businesses and restaurants in the city, and I encourage you to continue to do that, as this has been an extremely difficult time for them economically and their staffs as well. So anything that you can do in terms of frequenting those small businesses that you know and love is very, very, very much appreciated. Thank you.
Thank you, Director Sheehan, and again, our friend and always my conduit on a federal level, Congressman Chairman Neal Ritchie has been great when we look to be innovative with the HUD and CDBG money, so we appreciate that. As I stated earlier in the update, Solicitor Pakula and HR Labor Director Attorney Bill Mahoney, pretty much status quo report that was Oh, Patrick. Oh, geez. How could I forget the Wizard of Oz? As Billy Sullivan would say, God rest his soul, it's a mistake of the mind, not of the heart. The director of Facilities Management and Parks, otherwise known as the Wizard of Oz, Patrick Sullivan. Thanks, Helen.
Thank you, Mayor. Thanks, Helen. I was looking forward to being bypassed. But as the mayor reported earlier, our splash pads closed yesterday, and a special thank you to all the residents and families for following the guidance. We had a great summer. Sea Arena opens today. If your team needs ice time, it's for practice and drills only. That number is 787-6438. Bob Kirchner had contacted me late Friday. He's about halfway through his calculations on the buildings. And I shared with the mayor and Dan Warwick that he's been pleasantly surprised with the condition of our systems, the cleanliness of them, and that goes to credit to our HVAC tech crews who do a great job. So I think we'll have some good news from him and basically the guidance that we're going to need as we move forward in managing COVID. And then also, as the mayor indicated, a special shout out to Andy Gay, who's our Green Superintendent at Veterans, and Anthony Cole, the Green Superintendent at Franconia, and their crews. The two golf courses were chosen as the #2 staycation in Massachusetts by the Mass Golf Association, so that's a real compliment to their efforts. And then finally, a special thank you to the residents who continue to make the appointments to come either here or Tapley Street. And we will be continuing to review those guidance with Helen and the mayor as we approach our winter months. But I think it's one of the key factors in what's keeping Springfield green, so we will probably stay with that appointment system. Thank you.
Thanks, Pat. Thanks, Pat. Director Sullivan. You know, Helen and Pat are like the dynamic duo, you know, so it's, they watch each other. What's that, Helen? I got your back. Is that it? It's Monday morning. We need a little bit of a laugh. Again, we received financial. I gave you the update with TJ Planner, CFO, and Solicitor Pakula, and HR Labor Director Bill Mahoney. So at this point in time, if there's any questions and/or comments from the media for the cabinet heads or myself, I'd be more than happy to answer any questions if we can. Paul? Nice mask, Paul, by the way.
Have you had any feedback since the announcement Friday night about trick-or-treating?
Yeah, and it's been good feedback. It's been good feedback. You know, we are dealing with a pandemic here, and everything that we have done. I remember very distinctly when we had the freak nor'easter that occurred back in late October, pre-Halloween of 2011. And we had people calling the office or calling my house. And again, we had trees down all over the place, no power, electrical lines down all over the place. And people wanted to know why I postponed trick-or-treating for each and every one's public health and public safety. Here, in consultation with Commissioner Helen Carlton Harris, who has given me, with my rest of my cabinet heads, wise and just wisdom, this is a no-brainer. You know, with children at times, it has been documented that they can be super spreaders. You know that people are very leery about opening up their door. You know in the maps that Commissioner Helen Carlton puts out that there's a number of residents in the city of Springfield that have dealt with COVID or dealing with it right now. Why in the hell would you want to put your child or yourself in harm's way? It makes no sense whatsoever. Now, in turn, Helen and I spoke about, with my other cabinet heads, we want young people, children and families to be able to enjoy themselves on Halloween in a structured way with guidance. And we are working with a couple of entities who are looking to do that. But we've worked so hard to get to a green zone, and as Governor Baker has indicated, for a mid-sized city in America, urban center, it's just quite an accomplishment. I don't want to go backwards. I want to go forward. So it is what it is right now. And once we defeat this, we look forward to trick-or-treating. I love doing it. Every year I make sure I'm home. The kids come, neighbor come by, and I hand out those candies. I love it. It's great interaction. I'm unable to do that this year, but that's all on public health and safety guidelines. So I know there'll be some that'll be disappointed and or upset, but you know, overall I think the feedback has been pretty good and said that it's the right decision to make sure our children and family members are protected. So that's where we stand on that. I should have brought some candy for you, Paul, okay? Go ahead, Paul. Yeah, I wear a costume every day. Any other questions or comments? I'm making the sign language people laugh today, aren't I? I love it. I can tell. Yes, TV 22.
Same with also, is there a plan for enforcement? So you said there are going to be people who, hopefully not many, but
Right.
there will be people who are upset at this and may try to do this. Is there an enforcement plan?
You know, as we said too about not being the mask police or whatever, if something was to escalate to the point in time where there's a situation, then working through the health department and if needed, the police department, we will look into that situation. I just hope people are able to heed this. It's not even advice anymore. It's again, there's extreme power. Forget about me, right over there. Commissioner of Health and Human Services, the Board of Health, Helen Calton Harris. We're under a pandemic. We're under emergency orders right now. So you can't do it. You know, plain and simple. And you've seen across other states where they didn't follow proper procedures or they reopened too quickly, they have gone completely backwards in shutdowns. So, I mean, you know, for a candy bar or, you know, a lollipop, whatever it is, you want to put somebody in harm's way? So if we have to, again, the residents and business committee have been great. They've really been very good about adhering to our advice or our public health orders, and I'm hopeful they will do that. If you look at the press release we put out, I think late Friday, it does give the reasons why, but it also gives some guidance on how possibly, following a checklist, that you might be able to do a structured type event. Better you do not have your children visiting door-to-door trick-or-treating than you have to go, God forbid, see a child or someone else in a hospital. That's my viewpoint. Yeah.
Just to follow up on that, so is it possible that you could find people who engaged in door-to-door trick-or-treating, or how would that work? Is there a possibility of a fine of some sort?
Commissioner Clapper's going to deputize you, Paul. As we've done with Helen, Commissioner Calton Harris, and our police department, we have tried to educate, and try to avoid confrontational situations. And that has gone very, very well. We have things in our capacities that we can do if we have to. I just hope we don't have to reach that point in time. Any other questions? Boy, hot topic, I think, trick-or-treating, huh? Any other questions? Any other questions or comments? All right, to the residents and the business community, first of all, before that, to the media, thank you very, very much. You're constantly getting our information out, and I think that's important. It stimulates discussion, it gets information out, it makes people understand why we're doing something, why we're not doing something on it. And to my cabinet heads all the way down the rank and file, tested and true, you've done a great job. And to the residents of the city of Springfield, and I think it maybe was Matt Safransky might ask the question, we're going to get through this and we're going to beat this thing. As we transition toward that, it's still going to be important that we have to follow wearing of the masks, socially or physically distancing, washing your hands. If you don't feel good, stay home. I mean, it is paying dividends here in the city of Springfield, and I know sometimes it's tough love, but better that your loved one is feeling okay and home with you not in a hospital. So we continue to move forward on all cylinders, and we cannot wait until the day when, you know, we can open up the gates again. That's what we're all looking forward to. So go out and have a great day, stay healthy, and God bless. Thank you very, very much.
Thanks, Mayor.
Thanks.